Hello, my name is Damon Navarrete, and today, I will be presenting the topic of how depression in older adults may present and how we can potentially treat it through psychotherapy. First, we want to define the disorders associated with depression and how they can be diagnosed through the Diagnostic and Statistical Manual of Mental Disorders, version 5. The most known depressive disorder is major depressive disorder, or MDD, and can be diagnosed through a person exhibiting 5 or more of the criteria during a 2-week span, such as depressed mood, little to no interest in hobbies, weight loss or gain, insomnia or hypersomnia, fatigue, feelings of worthlessness, guilt, shame, less concentration or ability to think, and thoughts of death and/or suicide. Another form of depression is persistent depressive disorder, also known as dysthymia, is similar to MDD but with a longer span of about 2 years with less consistency in the symptoms. With older adulthood, the characteristics show a general decline in physicality as the body shows slower reaction time and the result of our life decisions on our body begins to show on our health. Cognitive decline is also common except for crystallized abilities and procedural memory. Becoming a grandparent starts to be of more importance and marriages become more satisfying to those with spouses, with friendships even becoming more close as well. Retirement becomes more prevalent, if not the search for less stressful jobs happens, with ego integrity from Erik Erikson's theory of psychosocial development accounting for an acceptance of oneself. The increase in spirituality and searching for realizing your sense of self is also notable during older adulthood. With the prevalence of depression in older adults, there are about 2 million Americans at the age of 65 and older dealing with some form of depression according to Mental Health America. These may be comorbid with other diseases associated with older age, such as Alzheimer's disease, Parkinson's disease, heart disease, cancer, and other ailments. One of the most widely used therapies for depression treatment is cognitive behavioral therapy, which combines both techniques involving cognitive thinking processes and behavioral activity changes. The first step is to help encourage more active lifestyles, such as more exercising, engaging more time into one's hobbies, and even socializing more to help alleviate the initial depressive symptoms. The next step is to challenge the automatic thoughts involved, usually through a therapist asking their patient to record these thoughts throughout the day and bring them back for discussion during a session. The third step is to identify illogical negative thinking and help show the pessimistic biases that exist through the eyes of the patient. The therapist will help to change the negative interpretations and create more positive ones instead. Finally, the fourth step aims at changing the primary attitudes associated with the root cause for depression in the first place. Through the use of cognitive behavioral therapy in older adults, the struggle in accepting their physical or cognitive decline with their age can be treated, along with their depressive symptoms, as the therapist will challenge these attitudes by explaining it is a natural process, allowing for the patient to be more content. Recovery of depression is most effective when cognitive behavioral therapy is administered with antidepressants, yet it has to be also balanced with any other pre-existing medication as well. Psychotherapists have successful sessions through discussing problems at home or with any other issues older adults may have, and improvement can also be shown through helping older adults embrace spirituality to help finding meaning in their life. In conclusion, while older adulthood is a phase of life having less instances of depressive disorders in comparison to other phases, it is still important to understand how individuals still have issues with adjusting into the next period of their life. Modern techniques into depression treatment have gotten more advanced than cognitive behavioral therapy, but it is a very important first step toward recovery that helps numerous people in the end. Thank you for listening to my presentation and have a good day.